Hi, Dr. Yoshi Ram here. Today's video blog. Did you know that the most commonly diagnosed medical condition in the US is high blood pressure, or hypertension in medical jargon? And guess what? That means that multiple blood pressure medications are in the top 10 of the most commonly prescribed drugs in the US. And of course, these medications are absolutely needed sometimes, especially in emergency situations. However, these medications can cause many undesirable side effects. Now, myself and at Oasis Family Medicine, we find it's better to address the underlying cause of the high blood pressure rather than just jumping right to a Band-Aid approach and the prescription drugs. Now first, why should you even be concerned about high blood pressure, right? Well, because it can raise your likelihood of a heart attack, heart failure, kidney failure, diabetes, peripheral vascular disease. And check this out, 30% of the population has high blood pressure, and another 30% has pre-high blood pressure or borderline high blood pressure, otherwise known as pre-hypertension. So diet and lifestyle changes are definitely the most effective approach according to study after study after study after study. You get the drift? Now, instead of treating symptoms with drugs, I suggest addressing the actual causes of high blood pressure for better health that is actually long-lasting. Studies have shown that lifestyle changes alone can absolutely reduce the risk of heart disease by a dramatic 90%. What did I just say? 90%. Regular exercise is one of the best ways known to control high blood pressure. Other important factors include a whole foods diet, rich in plant fiber and low in sugar and low in sodium, maintaining a healthy weight, not smoking, managing stress. And I would say stress is a huge one, very important to address. And you can manage stress through things like yoga, meditation is wonderful, walking, laughter, especially laughter. At Oasis Family Medicine, we look for why the person has high blood pressure, right? Rather than simply at what can be done to lower it. It's a person-centered approach versus a disease-centered one. Aside from the lifestyle habits just mentioned, other factors to consider include genetic predispositions, nutritional deficiencies, environmental triggers. These might include things more specifically like deficiencies in nutrients such as potassium, taurine, biotin, vitamin D, vitamin C, vitamin B1, choline, magnesium, and probably CoQ10 also. Too much sodium without balancing it out with other minerals, especially without balancing it with potassium, can be bad for blood pressure. Magnesium deficiency is a huge one. Almost everybody in the US is deficient, and probably 70 to 95% of the population. Magnesium helps relax the blood vessels, which is the same as a calcium channel blocker might do if you're to prescribe a prescription drug. Other things are toxic levels of heavy metals, especially mercury. Chronic systemic inflammation is a problem. Elevated blood sugar is a problem, including like prediabetes and diabetes. Hormonal imbalances can also lead to high blood pressure. So as you can see, there's a big list of potential causes, and we at Oasis Family Medicine do address the root cause of the high blood pressure by addressing all of these factors. Now, word of caution, please don't just go out and buy all the aforementioned nutrients and expect them to work like a charm, because these do need to be balanced in the right way to obtain optimal benefits. So I hope you found this video useful, and as always, please feel free to pass this along to a friend or a family member, especially if you know they have high blood pressure or even pre-high blood pressure if you're a little bit worried about them. Again, this is Dr. Yoshi Ram, and if you want to make sure that you get these helpful health tips on a regular basis, please subscribe to my blog or this YouTube channel. Thank you very much.